Brigitta, do you want to say a few words, who we are and what this is about?
Yeah. So it's two committed women in monster organizations that try to have a reasonable footprint on development and large-scale change processes all over the world. So this presentation was already shown in a way, as you can see, on May 6th in DC. When one of our colleagues from GIZ, who is in charge from the sector department, was presenting to the also sector colleagues in the bank. I'm happy to present this today together with Ceren, because you really try to make a difference with this within our organizations. And so what you will be seeing is, on the one hand side, the sector program and the prototype, the pilot that we have been trying to implement, but you will also learn and hear something out of the meta level, means the internal large systems change process that we try to foster and support with this interesting experience.
Great. Thank you, Steve. So Brigitte and I, we represent externally facing, or let's say client facing leadership teams of World Bank and GIZ. The way that our organizations are built, we also have sectoral teams. Health work is quite essential to the missions of both institutions. And in the case of GIZ, there's a lot of expertise on capacity building and supporting systems. And the World Bank is very strong on project and project lending. So with that background, this work has its roots in a realization when one of our colleagues from GIZ, a sector person, health sector person, Olivier, was leading the GIZ side of health work in Bangladesh. Bangladesh had one of the, actually the world's largest sector-wide approach, where development partners, donors come together. And there was about $5 billion allocated for health sector work in Bangladesh. And the World Bank was the manager of these funds, but it had to bring together a large pool of donors. And of course, government players, not just the health ministry, but other ministries and agencies and civil society and private sector. Interestingly, around those times, myself, as well as my now deceased wonderful manager Ed Campos, whom some of you met, a great political economist, we were based in Bangladesh as well. We were political economists trying to understand obstacles to institutional capacity and governance in Bangladesh. And we were mesmerized by the health sector. The needs were very obvious. Poor people couldn't access to the health services, but also when it comes to universal health coverage, even middle-class Bangladeshi citizens quickly and easily fell into poverty as soon as there was a health shock into the family. So, for example, Olivier shares this example from his life. A GIZ person, a Bangladeshi person who was working for GIZ, when his wife fell into a coma during birth delivery, there was this terrible journey that started for them. The health costs basically diminished this family into a poor household from a middle-class family, upper middle-class family. So the needs were obvious, and also the multi-stakeholder dimension of getting universal health coverage and building systems for health is very obvious. It involves many ministries, different government agencies, important stakeholders from private sectors and civil society. and what we see in Bangladesh and many other countries, all these stakeholders have very entrenched interest or sort of viewpoints, and very hard for them to even start a dialogue, a constructive dialogue. And that's basically what got us started thinking whether a leadership program around universal health coverage, bringing different stakeholders, would be helpful. Maybe we can move to the next slide. Thank you. The levers we thought of were, and this is what Brigitta and team does really well. Their work is sort of embedded into the idea of U theory. Otto Scharmer and others work on deep dialogue, building trust. And that we felt was a good basis of establishing effective collaboration mechanisms. What we as the World Bank folks, leadership folks, were good at was this results orientation and thinking of coalitions in a sort of a way of, understanding stakeholder interest, engaging with stakeholders, thinking of the communication aspects of that. So we thought that we could bring these together. And an important part of the program was this learning by doing and demonstrating success during implementation through what we called collective action initiatives. And there was also this aspiration towards peer learning and knowledge exchange from the people and the countries that would participate into program, but also learning from the experience of countries such as Turkey, who have achieved universal health coverage within a decade. This is this was of almost a year long work involving, and we'll talk about the countries and the profile of teams participating from countries. But just to give you a sense of the process or the journey, this is what it looked like. We had an initial phase of working as 2 teams and 4 key groups: the health sector of the World Bank, the leadership group within the World Bank, GIZ health sector, and then the GIZ leadership folks. This is Brigitta's team. The 4 groups we engage with are fellow colleagues in the countries, also some of our country clients, as we call them, or I guess key stakeholders to this process, picking their brain, what is needed, what could be a good model. So that preparation led way to this 3-step kind of a journey. We started off with a 4 or 5 day workshop in South Africa. And this was basically the participating country teams getting to know each other, as well as the other country team participants. And we had 2 colleagues from Presencing Institute with us as well. Their participation really enabled bringing in this idea of a deep dialogue, deep listening, engaging at a different level, and sensing the system at a very different level than what we often do. I would say, I think Brigitta's work is already more along those lines, but what we are accustomed to at the World Bank was really transformational from my point of view. Following that workshop, we basically asked our country participants what would they commit to do till the second one, and it was mostly around sensing their systems. So could they look at the health systems that they were operating in and the universal health coverage agenda from different points of view and perspectives, and understanding the system more deeply. and engaging with more important groups to this work, to this agenda. That led way to the second workshop in Kenya in November. Here we had a combination of further coalescing as teams, really emphasizing those deep listening skills and engaging with people in a different way, but also bringing in some of the things that we do well in the World Bank, I believe, understanding stakeholders, understanding networks, how to engage stakeholders, talking about coalition building, and then also results orientation. And then we basically, each country team came up with almost like 100-day sort of initiatives. And this was one of our opportunities and challenges. A more open-ended model would call these prototypes. A more closed-ended model would call these like results initiatives. Because this was the first time that we were working together. World Bank, I would say, more close-ended model, and GIZ and Presencing more open-ended model. We sort of kept it a little open and see what would come out of this process. And I think our teams were mostly on the driving seat. We didn't give a lot of instruction or guidance on, say, what these initiatives could look like. And there was the availability of leadership coaching support from the Presencing Institute folks. I would say there was not much uptake. So we went to the third workshop, which was the closing workshop, with, not knowing really what to expect the results would be. The teams seem to have accomplished quite significant outcomes, and I think maybe Brigitta could talk to that a little bit towards the end. What I would say about Turkey as well, by the fact that we could be in Turkey, and this was a request by the participants, if we could go to Turkey for the last workshop, we could also bring in this inspiring story of the Turkey's transformational reforms in this field. Yeah.
I'm wondering, Ceren, you had mentioned at the very beginning about results orientation, and then you mentioned the open versus closed-ended. Mm-hmm. And I'm just wondering, was this clear when you approached it about how to handle this these distinctions? Or maybe you could talk more about these distinctions and how they're negotiated, because everyone always says, oh, the World Bank, they're really results-oriented and they have trouble handling these intermediate complex challenge processes.
Yeah. Steve, yes, I think, that's why I'm delighted that we have an opportunity to talk about this program. I mean, at the end of the day, it's just one of the leadership programs, but I think why it's interesting is precisely because of this, that we try to bring in, without really a too much agreement at the beginning, but intuitively we knew that this would be powerful to bring in an open-ended model. And at that time, I think we, meaning the World Bank folks, we weren't really aware how close-ended our models are. So, working with Brigitta and our friends at Presencing Institute, it was very obvious that there often was model clash. And unless I think there is an absolute dedication to the to working together as one team, and to be fully at the service of the people who are benefiting from these interventions. And if you're worried more about the bureaucratic, checklist and stuff, it's very hard to make it work. So about the open and close-ended model. So yeah, maybe we can talk about this at this point. we use results-based management or rapid results technique. I think the reason that they kind of got traction at the World Bank was because we do project landing or technical assistance. That's again very mechanical. You know, there are development objectives, then there are intermediate outcomes. It's very easy to fit those results methods into a project, documents outcomes, and say teams will work on XYZ as it's listed in the project document. Whereas the prototype approach is really about bringing these individuals and teams to look at a problem or an issue in a much deeper way. And most often they might find that whatever was in the project document is not the key constraint, or it's not what they want to work on, where they believe they can have the highest impact. And also, from our management's point of view, I was really under pressure every month to, you know, report on the results of this program. Mm-hmm. And I was at a loss because, you know, when you have a prototyping, your teams are prototyping, they haven't committed to a set of results. They're trying things out. They may fail, they may succeed. I would say those were the challenges. But then why take the pain of working with an organization like the World Bank? You know, I mean, when you have an institution that manages $5 billion for the health sector, and all the development partners, you know, like are managing basically that process of bringing the development partners, is probably one of the more influential development partners in dialogue with the government and civil society and private sector. You want to also be able to influence that institution from within. And I always ask this question to my Presidency Institute friends. I said, why would we do this work if Aspen Institute or Presidency can do this alone? I mean, what could be the value add of doing this within the World Bank or within the GIZ? So I think that project connection is important. And what would be so wonderful is at some point through all this trial and error, if you could come up with something where we could still have a close link to the project and landing, but be more open-ended and be able to really tap into the power of systemic change methods and approaches. Sorry, I went on too long. I'm sorry, I've been blabbering.
Ceren, that is really, really interesting to me because, you know, I've been working with the Rapid Results Institute recently, still do. Mm-hmm. And we are, of course, now looking at it from the other side, is saying, how do we make these results-oriented approaches more systemic? And I think in a way that's and there is some engagement with the World Bank again at the moment. And I think that really is a very important issue we need to grapple with. So people who understand the sort of process-oriented change, the Presidency Institute stuff you're talking about, and the project stuff, is how do we bring that together, and how do we support the change process within large organizations like the bank. I think it's really exciting that you're doing this work.
Thank you, Mila. I would love to learn more about your the work with Rapid Results.
Yeah, I really think we should talk about it.
Yeah. I'll follow up.
Okay.
Steve, how are we doing on time?
We've got another 12 minutes for the hour.
Okay.
I'm happy to stay a bit longer if you can, but that's where we are. But I wanted to say that is the open-ended, the key concept with the open-ended piece as opposed to closed-ended is being able to do these projects and having the the, as you described, clients identify what the projects are, the pilot projects. Is that the key activity that's distinctive?
I would, so Steve, I don't know if I understood your question fully.
I'm just trying to get more.
One of the pain points though was this, and I think that's also the highest potential for why we would do this in-house rather than say work with one of the existing amazing institutions that do this type of work. What's the value out of doing this in-house? So it was the opportunity, but then the pressure point was also all these requirements of reporting and being relevant. So one example I can give, Steve, is our staff, the teams that the teams and team members who are leading the health work on the ground or based in Washington D.C. but leading the work, you know, they have big agendas. Their programs affect usually millions of people. You know, their projects of millions of dollars lending every year or capacity building. These are committed people, often burdened because they have already a lot of work. Knowledge work, this type of leadership work is not high on their agenda. It's not really rewarded by the institutional system. Sometimes it's not even in their work program. So they would often ask us, yeah, let us know how we can help you. But they often did not see this work as helping them, because it was it's at least in the first edition, it was hard for us to keep the integrity of the program all the while connecting this work tightly into the operational work.
Yeah.
I don't know, Steve, if that kind of starts addressing some of the thoughts you had.
Well, there seems to be two critical points here that you're bringing up. One is how to do this work, if we could say, in the belly of the beast. And the other one is how the open-ended versus closed-ended approach, how to shift that, which is part of doing it in the belly of the beast. But the belly of the beast has to do with reporting, how to work with in current structures, etc. So just to note, those are the two key things that that I've noted as the challenges that you've mastered here. And I was interested also that you had started with it from a leadership perspective, because that intrigued me, because that didn't seem to be what I would consider a traditional bank approach either. So you've answered some of those thoughts. And also, you started out by sort of making a joke of it, but it seemed a relatively, perhaps, a critical factor was that you and Brigitta were working together. You said there's two women who did this, and but that it was two organizations. So you got to, I imagine there was a bit of negotiating politely between the two organizations. But because there were two organizations, you probably ended up freeing up some space for negotiating things that would not be there if you had one organization. And also because you two were both dedicated to this in terms of complex challenges, this insight about a new type of leadership, that you were there to support each other through it too. So it wasn't one of you left out there on your own. So I don't know if that rings true with you. You might like to comment on all that.
It resonates with me greatly, Steve. I think you've sort of really distilled the most valuable points from our experience, and I wonder if Brigitta would have some thoughts.
Yeah, I mean, I was talking about two women, but in fact, the person to do this together with Ceren on our side was Klaus, who Steve also knows, and I just happened to be also part of this effort, so that's why I'm sitting here, and because of the book proposal. But he's the person who was trying to make this happen. So as you said, Steve, I think it would be the third critical point, or the difference I'd like to stress, that although we know that we're in times of post-heroic leadership and management, it still depends on the one person that makes the difference, because there were so many ups and downs in this process on the organizational level of the bank and GIZ, trying to make two systems fit to really create an added value for the people on the ground and for the health systems. That was due to the attitude of the project managers on our side, and it was also due the real examples, like the one that we have been sending over, the Nigerian lessons in transformational leadership. Although it's a really humble person, Francis, the protagonist in Nigeria, he was the person to make a difference. So, and I like to stress that, because I think it's really depending on the people that are trying to, against all odds, making something happen. And it's like, it's different, and you're getting so much opposition and bad energy because you're trying to do something different, and you have to stick to it. And the spillover between the two organizations was, of course, important, because whatever I said about, well, we're doing this together with the World Bank, the convening power of the World Bank, of course, is seducing my organization to say, okay, it's the bank, although there are many things that could be taken into account on the not so funny part of the experience with the bank. Of course, the bank makes a difference. And so hopefully the same was true for Ceren, trying to open up spaces in the leadership, learning, innovation team, saying that the GIZ is supporting, and we're trying to make this in a different way. So the trust building was the part that came more or less from our approach. And I think this is the important part. So as Ceren said, working as one team, although you have all those constraints, the bureaucratic, technocratic, and culture lenses that you have to deal with, is part of the critical success factor, I would say, and being persistent, and although it was hard, still trying to do this. And just to go on the meta level, what we did, for example, on our side, to understand better Ceren's position, Ceren's way to interact with us, was to do constellation work, to use methodologies that helped us to understand the whole stakeholder setting that we were experiencing. So real physical constellation work, because it was so confusing in one moment to understand what happened over there in DC and why. So really getting into the shoe. So it's the whole range of skills and competencies and methodologies that are part of our toolbox and our array that we're using, that Otto was providing with the generative dialogue, for example, to really make that happen and to really walk that talk in our day-to-day project management. So that's so it's the person, and it's the skillfulness and the spillover. So it's a real making all this happen and work.
I think that's very, very interesting that you're using the constellation work, because that is also part of really getting sort of constantly in real time mapping the evolving you say stakeholder constellations, the constituencies that each of the partners have to deal with in making systemic change. And I do think that is a very important part to include from the case study, how this sort of concentrated focus on the leadership development program becomes a focus for taking in mind and making tactical decisions about how to deal with the various constituencies out in of course the participants do have to deal with, and providing them with the support to do that. And in that sense, I guess the open-endedness in terms of sort of the time boundaries is very important, because you can't expect system change to cooperate with program schedules.
But that's what we always do, right?
Yeah.
So that long-term commitment is, I think, very important. And I guess one of the questions I suppose I'd have in the longer term is how that can be resourced and managed over time, because you know, that's often the issue. Is you have a cohort of people who finish the program and they become alumni, and well, the work hasn't finished. And universal healthcare isn't necessarily established just because they've completed the program.
Yeah.
I'm really sorry. I'm going to have to go now. We've just hit the hour, and I've got something else to go. But I think it's so interesting. Fantastic case.
I just wanted to say, Jonathan, before you go, that also echoes some of the discussion at the Rotterdam meeting with the word assemblage that caused so much discussion when David Snowden suggested it. But I mean, I think that those were essentially the same issues of the fact that what you see as a stakeholder in a complex network will look different depending on which stakeholder you are and where you're sitting.
Very interesting.
Yeah, maybe just to mention that in the next round that we want to be doing in Asia, we'd love to, prototype with Dave Snowden's approach on the sense maker to tell the story in a different way. And maybe also to, Jonathan, to also take this to another level and to make it more systemic and not just having 20 to 25 people being the critical mass that will be working. And in the future, if we're programming it differently, it could be also much more integrated in the World Bank's programs as well as our programs, and much more donors programs. But it would be, of course, more work to get them on board. It wasn't easy to have us there. But with Dave Snowden's approach, it might be interesting to have a different narrative, because he would, of course, refrain to say it's the individual that makes a difference. I keep saying that, but creating a different narrative on this large systems change by having that story told in a different way and making accessible and making it a tool itself. We want to be experimenting with this in the next round.
Yeah, I think that's a great idea. I've done a bit of work with that tool actually, and have a bit of experience to talk about another time. I'm so sorry I've got to go. It's so interesting.
Bye-bye.
Bye-bye. See you in November.
Bye now.
Bye.
I'm just going to go through to try to wrap this up. If I'm sorry, I'm not doing justice to the quality of your work, but to wrap it up in terms of the way we had been discussing this as a group. What piece of the elephant were you working on? So it sounded to me that I'm wondering how you think about it in terms of this slide, or whether you can describe it in terms of this slide. Obviously, the individual had and you were looking at how to work with individual leadership was one of your frameworks, but you were doing it very much in a social, political, economic context and needs and values. I'm wondering if you have any extra time, if you can just talk about whether any of these levels or types of change, spheres of change as we describe them, interacted with you at the project.
I think, Steve, your assessment is spot on. It's and I'll say by bringing GIZ and the bank's sort of approach to leadership, we were able to really start with a solid base of the individual, which is not often we pay a lot of attention to, I must say, in the World Bank. But then really embed that individual's journey into sort of teamwork, and also thinking of the type of coalitions they need, understanding their stakeholders, understanding the context they work in and the system they work in. So I guess that fits with the social, political, economic structures, but also a lot on the values and beliefs, because the health coverage is, at the end of the day, is so much fundamentally about people's beliefs around fairness, how resources should be allocated, and
so I'm wondering whether it's a case where we could say, if I've understood you correctly, that the World Bank would traditionally focus upon the social, political, economic structures, and you've built a case for pushing on a different piece of what needs to change to get there.
And that piece is individual, you mean?
Yes.
Okay. Yeah, I agree. Brigitta?
Hmm.
Yeah.
I'm still struggling with this model where the values and beliefs are in an outer space. I mean, I'm not making this up to have an academic discussion on that, but if we're working on the individual, we're working on the values and beliefs part. So it wouldn't be outside, but it would be right in the focus of the individual, because it's about bringing coherence between those values and beliefs of the individual and the organization and the system. But maybe I'm just misunderstanding the model. But yes, I would clearly subscribe to that. The difference was how we worked with the individual. One quote of one participant was interesting, because in the third workshop, when we had the Turkish experience and the more sector part focused on, he said that he was missing the more personal reflection time and leadership strengthening part in that he was experiencing in the first part of the journey. So what they said, in fact, was, well, we have enough experience and we have enough sector expertise. What we need is much more time to really grow as individuals and as leaders and have that peer reflection. So and the personal value and belief systems reflected on.
That's really interesting.
That's very interesting. I think I also really appreciate your critique, if I could put it that way, of the diagram, because what the diagram is trying to get at is what you were saying at the very end, I think, that there's a greater sea within which we live, which says it's not about the individual, it's about the structures. And that we've also got to pay attention to the individual leadership capacity and how we spend time and treat people and support their growth. And that's part of what I would say is the greater memes setting. And I really appreciate that, because it makes me think about it in different ways.
It wasn't a critique. I just tried to understand the model as we have one. I'm trying to understand that one, and if it works for us and how we could make it work.
Yeah, I took it positively. When I say critique.
Yeah. You know, just to share that maybe, when I was leaving after 6 years in South America, and I was having a presentation, the funny thing was I was presenting structures on my slides, on my PowerPoint slides. So it was white elephants in Peru. It was structures that the development donors, whatever, left. But I was bringing all the people on the stage that had been collaborating in the past 6 years together with me in different parts of South America. So it's about structures, but it's all that guys that were on the stage that made that difference. So bringing this together in the right way to really deal with the complexity, as you do it rightly here in this setting. I mean, you're trying to create something through specific individuals. That's what you're doing, right? So, so this is exactly the mystery. Because it's mystery, you have to deal. It's magic if you make it happen.
And bringing in this other we have in the article, this other piece about the change strategies. So you were working in what I would call heavily in the co-creating change piece. You know, like. The social labs as an archetypal strategy. But there was also the supporting change that seemed important. Like the bank comes in with this donor money because it's sort of the noblesse oblige, upliftment of the people piece. So I just to try to stretch my thinking about how this might be useful to understand how they interact. That's where I'd like to get to with this book and the bigger strategies.
But I think, Steve, that's exactly what Adam was trying to say in that email exchange you had. It's always power and love. It's always, it's how do we walk on two legs? How do we combine power and love? So it's how do we combine attention to the inner development of the individual and the the structures with achieving results and moving forward and bringing about change. And I think that that's the sort of alchemy that we're looking for here, is how do we combine the energies of people who are focused on results with the energy of people who are focused on the leadership development. So, yeah.
Excellent.
Yeah.
There was the one other piece I had here was this diagram, which I know some of us know already that you can't show. I don't think I want to go into it right now, but I'm just wanting to again think about ways we can have of looking at across these experiences about what's emerging that can be informative for us, that we would like to focus upon more.
Yeah. I would like to say I'm really interested to hear more about the prototyping and what happens next, because I think our experience in the lab in South Africa was that, that first, the cycle that you've gone through is very useful. People really begin to change. But how do you take the prototyping phase into multiple phases that continues the momentum? So I'm really curious about what happens next for you.
Ceren, do you know much about the prototypes? I'm just familiar with the Nigerian case, let's say, the prototype that's going on there. My feeling is that we should be focusing much more on that part. We're still weak on that leg, on how to support that phase. We have been weak in this part in the past, and we should be really putting much more energy to there. I know that my colleagues, the sector guys here in Germany, together with the P4H network, are still supporting. So by constant exchange, it's already like a support system that helps to keep the actors alive and kicking, and because, for example, the two images that I was putting in the article we have been sending over, they're just recent. So they're still feeling that they are supported, that there's interest in what they are doing, that they are getting the peer support. We are having like a shared workspace where they could exchange. I think that they don't exchange that much as they could, but there's different support systems that they are using still. Ceren, can you comment on that?
Mila, I think that's an excellent question, and that's really also what's been. I think most of my energy around this work of thinking how it could be more effective and how it could have more of a contribution to the field is precisely in this area. I think prototyping is an amazing tool or approach to allow the full creativity and experimentation. But as what Steve called the belly of the beast, when you're working from the belly of the beast, it somehow doesn't lend itself to be a very effective approach to neither get support or power or resources, nor also to do the proper follow-up. So what Brigitta is referring to in the case of Nigeria, I think we had a tremendously motivated team and a team leader who's driving the work, and also a bank staff who and GIZ folks. They are not based. GIZ folks are not based in the country. So when Brigitta talks about their support, it's more like a remote support. What we're, I think, interested in is to get our colleagues who are on the ground and leading the operations on a day-to-day basis to feel fully committed to the process. And channel the resources, the support of the operational work to these teams, so that the prototyping is not just one prototype that dies in the second and third iteration, but it becomes way of working, and it becomes sort of sustainable.
Yeah.
And I would love to brainstorm and work more on how to get this resonate with our teams, and they need to see why. When I say our teams, meaning our staff, they need to see why this is useful for their work.
Yeah.
With the prototyping, I don't think they see it, or the language that we use around prototyping, they don't see it.
Yeah, no, I'd love to talk with you a little bit more about that. Are you working with the people in the bank that deal with doing development differently?
Yes, but yeah, the bank is so fragmented, so I know about their work, and sometimes, if there's any particular person you want to connect with,
let's talk offline, because I think there's some interesting opportunities to think about these things.
Perfect.
A bit on the same note, today I sent out a blog on social innovation labs. It comes from a guide that Frances Wesley has put together, who I have immense respect for. She's working with the Stockholm Resilience Center on numerous things too. And the one thought that came from me is that I always am working on the upside of the U, of Otto's U, about how to sustain this change, and that the lab structure might be held on to past its usefulness, that it emphasizes the labs as the initiating part of transformation.
Yeah.
And then we need to think about different structures to move things out. And the two structures that come to me, just because I'm familiar with them, and I know one of them won't resonate well with the bank, but it's community practice, and then action network, one form of them being global action networks. And how to convey the incubation into the hands of some other types of structures so that they don't get caught in the maws of the traditional bureaucracy, as where we know that won't work, because the innovation depend upon something other than the bureaucracy. So I think that that's a very interesting question about what the development process is in terms of the sustaining structures as well.
Yes. Yeah. That's interesting, Steve, because I think I've left the South African lab, but I think that they are doing that, and I think we need to follow up and just have a bit of a conversation with them, how they made that transition, and because in the end these structures are fragile. It often depends on funding, but our experience there was the tenacity of a few people to keep going, and you sort of get into the next cycle of action. So it's also taking the longer term view, which is difficult within the context of project-based funding, which seems to drive our lives.
Well, Mila, if I could take that as a suggestion that we use the Southern African Food Lab as a case, I would be very pleased if you could help make that happen.
Sure.
Because I would.
It's a little bit of a conflict of interest, I would imagine, but I'm happy to. I mean, I think we need to have some interviews with Scott and others that are now still active in it, warts and all. I mean, it's not a perfect case. It's just, it's been around for a while now, so we can certainly learn from it.
Well, it's the history, the recent history that's important. That would be the interesting piece.
Yeah, exactly.
History pieces. So that would be great if we could add that to our list of webinars too.
Sure. Let me talk to Scott about that.
So I'd like to close off now, realizing that we're past our time. Before we go, I'm wondering if we might just have a round of people think this this webinar could be improved, and how to connect it to the book process more, or any thoughts about that, the connection between the two. Anyone with any thoughts about that? Maybe we could just do a round of checkouts and say what you found about this process.
Steve, so process question, of course, is very relevant to you, but if you would indulge me, I'd also just would love to hear some maybe quick thoughts from Mila and Sarah and you of how you see this case serving the book. Or has anything popped up for you? Anything surfaced for you?
Great, thank you.
Who goes first?
Why did you go, Sarah? You've been so quiet.
I've been listening. Isn't that great? I'm going to reduce it down to two words that sort of really stuck out. One was that discussion about constellations and everything else. I think that, and a whole load of other issues there, of the kind of coalitions of the willing, and the fact that the groups of people with the capacity to change are likely to change over time. For me, that idea of constellation and assemblage as itself a dynamic thing is something that was hinted at in Rotterdam. It's something that the presentation sort of showed, how critical everything is on an individual, but at the same time how a really good change process isn't entirely dependent on one individual. So there's something there about having the fact that oomph is held by a person, but somehow the momentum has to be, or the oomph has to be spread from one person to another. And I don't know quite what's there, but I think that that's a theme that needs to pull out that would be great to pull out in the book, because at the moment a lot of leadership is focused on, I think, this question of collective leadership, collective action, fluid leadership. We're all grappling with, I don't know, there's a lot of ideas in that pocket together. And it would be quite interesting to use the webinars to explore how experience illuminates that from different angles. The other word that really jumped out to me was the one Miller just said that also resonated with things from before, was the word fragile. And how, I don't know, I haven't quite unpacked that word enough, but it jangled a little bell somewhere. And again, about the fact that, many, many change initiatives start, but crumble somehow at critical points, or look rock solid and actually have lots. I mean, you're talking about the World Bank again, loads and loads of money.
Yeah.
What makes it fragile at the point of actual change? So I know those were the themes that just fit with some of the change processes that I've been looking at and playing with, and I don't know where to take them, but it would be lovely to keep those words in our mind as we have more of these webinars.
For me, I found particularly interesting thinking of you, Ceren, in particular, because I don't know so much about GIZ, but I do know enough about GIZ maybe, but how you as internal, working, as I said, in the belly of the beast, can realize a more comprehensive approach that brings in the individual rather than simply the institutional and masses of statistics and the traditional, we're going to do something on you and propose something to you.
Yeah.
So there's the key, the co-creative dynamic where the World Bank uses and understands, it doesn't just use the words, it uses its core competency, which is around, or legitimacy, which is around convening and about providing some money, and not getting into all of the, this is what you should be doing in your particular situation type of piece, but having that arise so that there is local ownership.
Yeah.
I find all of that particularly, I mean, there's so many people that would love to, that are in the situation, I think, of trying to figure out how to do that, working for organizations like the World Bank.
Yeah. Yeah.
And so if we're wanting to get, you know, rally that type of, but the people like you are, you know, working in that situation, that see how it needs to be different and really finding ways to do it differently. I think that's just an incredible contribution that we could make to what we would call the advanced practitioner.
Yeah. Yeah. Yeah, I would really, really echo that. I think understanding, what the world looks like from your perspective, from the perspective of people like yourself, and what you need to be able to do the work. So it sort of links for me to the system piece of how is this the sort of the change within the big organizations, and the change that we're trying to bring about outside. You know, how do those two things resonate with each other? So it's sort of the individual change, and also how, as a leader yourself, you continue to change and evolve, and how inside the system and outside the system, inside the organization and outside, how these things mesh or interact.
Right. And Mila, I think that's the most tangible way I feel sustainability, that we can address the sustainability issue. I mean, it's the hard way, but if we have a critical mass of these advanced practitioners who get it, I think we can change the mainstream way of working, perhaps.